Hi there, I'm medical malpractice lawyer John McKiggan. One of the most common mistakes that doctors make that leads to medical malpractice is failing to properly diagnose a patient's injury or illness. This usually happens because the doctor failed to follow the differential diagnosis process. Very early in their training, doctors learn to diagnose patients using the differential diagnosis process. Medical malpractice lawyers know that conducting a differential diagnosis before administering treatment is critical, because without a proper medical diagnosis, it may be impossible to provide proper medical care. The differential diagnosis process has 3 simple steps. Step number 1, get the information. The doctor must gather as much information about the problem as they can. For example, history, risk factors, signs, and symptoms. Step number 2, create a list. The doctor must create a complete list of everything that could reasonably be causing the signs and symptoms that they're seeing. Step number 3, rule in or out. The doctor must apply the differential diagnosis method to systematically conduct tests to rule in or rule out each item on the differential diagnosis list, starting with the most dangerous ones, until the doctor is left with one or more probable causes for the patient's illness. Many times doctors fail to properly diagnose an injury or illness because they fail to understand the difference between probable versus possible. Some illnesses and conditions are more common than others. Most of the time, the probable cause of the patient's illness turns out after investigation to be the actual cause. But sometimes an illness or condition may be very rare. It may be the possible cause, but it's unlikely that the illness is the cause of the patient's complaints. In other words, the odds are that the rare but possible cause is not the actual cause. But not always. Even if the odds are 1 in 1,000, 1 in 10,000, or even 1 in 100,000, sometimes the rare but possible cause is the actual cause of the injury. There's no guessing allowed. That's why doctors are not allowed to assume that the probable cause is the actual cause. If a doctor makes an assumption without considering all of the possibilities, the doctor's just playing the odds or guessing that their diagnosis is correct. A doctor who bases a diagnosis on probability rather than possibility is simply making a bet. Most of the time, based on probabilities, the doctor's bet will be right. But the problem is that the doctor is potentially betting the patient's life if they guess wrong. If there's no differential diagnosis, then there is negligence. Diagnostic mistakes happen when doctors don't use the differential diagnosis process or skip one of the steps, resulting in the wrong diagnosis, resulting in incorrect care, which can lead to injury or death. If you want more information about medical malpractice claims, call us for your free copy of Health Scare, the consumer's guide to medical malpractice claims. This public legal education guide contains everything you need to know to protect your rights if you think you or a family member has been a victim of medical malpractice. The book's for sale on Amazon, but we'll send you a copy at no charge if you call us at 902-423-2050 or just go to www.healthscarebook.ca.